Let's talk about health insurance. Everything you need to know comes down to four terms. MOOP, MOOP, that stands for maximum out of pocket, deductible, coinsurance, and copay. You'll also meet Billy, a little boy who needs our help understanding his own health insurance plan. First, MOOP. All insurance plans have an out-of-pocket limit on the plan, or a MOOP. This is the maximum amount you could possibly pay for healthcare services out of your own pocket within a calendar year, excluding premiums. Just in case you're wondering, premiums are the amount you pay each period, typically monthly, to keep the plan in force. Remember calendar year. So if your plan's effective date begins May 1st of 2024 and your out-of-pocket limit or MOOP is $5,000, that means from May 1st of 2024 to the end of 2024, the most you could pay out of your pocket, again excluding premiums, would be $5,000. With a family health plan, the MOOP usually doubles, but applies as one number to the whole family. So a husband, wife, and two kids might have a plan together where the most the family can spend out of their pockets is $10,000, but until that point is reached, if it's reached at all, $5,000 for each family member would apply. Now with that in mind, we have our remaining three terms: deductible, coinsurance, and copay. When you use the health insurance plan, you will pay in one of these three ways. First, every plan has a deductible. If you don't have a deductible, your premium is probably a fortune, unless you don't pay the full premium for whatever reason, but that's for another video. Deductible might also be known as paying the bill. Paying the bill means you have medical care performed before paying anything. So if my deductible is $1,000, after receiving medical care, my medical provider waits for authorization from my insurance company, and a bill negotiated in advance between the two of them, evident when my medical provider is in network, is sent to me. If the bill is $100, I pay $100, and my deductible going forward would now be $900. Next, we have coinsurance. Same exact process as deductible in that I see my medical provider gets authorization from the insurance company, the bill is generated. This time, though, I would pay a percentage of the bill. That's also known as paying coinsurance. So if the bill is $100 and my plan reads 40% coinsurance, I pay $40 and the insurance company pays the remaining $60. And then we have copay. Copay is a preset dollar amount. So $10, $20, $50, $500, but a set dollar amount that you pay when you receive healthcare services. Because the dollar amount is preset by your plan ahead of time, copays are paid to the provider before services are provided to you, after which your medical provider and insurance handle whatever else was, if at all, negotiated. Everything out of your pocket goes toward the MOOP. Remember, excluding premiums. So if your MOOP is $5,000 per calendar year, you'll pay deductibles, coinsurance, and copays until you reach $5,000. After that, you would pay nothing at all, nothing for the rest of the calendar year. Okay, so now that we're insurance experts, let's help out our friend Billy. Let's say Billy wakes up one day and is not feeling too good, so he makes an appointment with his primary care doctor to get looked at. How does he pay? Well, if Billy looks at the doctor benefit on his plan, he'll see one of three things: our deductible, coinsurance, or copay. Let's say Billy has to pay the deductible first. The deductible is $1,000. Billy sees the doctor. He would pay nothing at the office. The doctor checks his vitals, performs some tests, sends Billy home. The doctor negotiates with Billy's insurance company for the visit $100. Billy gets a bill for $100 and he pays it. His deductible going forward would now be $900. If he paid coinsurance, Billy sees the doctor checks his vitals, performs some tests, sends Billy home. The doctor negotiated with Billy's insurance company $100, but Billy's plan says 40% coinsurance. Billy gets a bill from the insurance company for the visit for $40. Billy pays $40, the insurance company would pay $60. In a copay situation, his plan says he owes $50 to see the doctor. Billy goes to the doctor and pays $50. That's it. Anything the doctor bills in addition to that is the insurance company's responsibility. Remember, all 3 ways of paying go toward the MOOP. All right, now let's crank this up a notch. Billy, he might be a sickly kid, but fortunate for us, Billy happens to be a rambunctious kid as well. So he's always out on the playground, up to no good. Of course, Billy gets a little crazy on the swings, falls off, breaks his arm. Good thing Billy has health insurance because he's going to need it. First, he goes to the doctor and he sees that he has a $50 copay to see the doctor. Billy pays the $50 copay before seeing the doctor, and that's all he'll owe. The doctor sees him, performs an x-ray, and says, "Billy, your arm is broken." Uh-oh. Billy's doctor writes him a script for a painkiller and tells him to go see a specialist. First, Billy goes to the pharmacy because he can't take the pain, and the benefit for a prescription reads 40% coinsurance. The insurance company negotiated $100, so the cost is $40 to Billy and $60 to the insurance company. Billy now goes to see the specialist doctor, and the benefit is 50% coinsurance. What happens? Billy sees the specialist and goes home. The specialist negotiated a bill for $200, and in turn, the insurance company would charge Billy $100. Finally, unfortunately for poor Billy, the specialist said he needs to have surgery on that broken arm. So Billy meets the surgeon at the hospital with a benefit that reads surgery is subject to deductible plus 50% coinsurance. So let's go over how this one goes. Billy goes to the hospital for the surgery, pays nothing, has the surgery performed, and goes home. Billy's doctor negotiates a price of $5,000 for the surgery with the insurance company. Billy sees his deductible is $1,000 plus 50% coinsurance. So who pays what? Billy will pay the first $1,000 of $5,000, satisfying his deductible in full. If Billy used his deductible for anything else in the plan before the surgery, that would also be deducted from the same deductible. Billy would then pay 50% of the remaining $4,000 for the surgery, $2,000. But last but not least, remember the MOOP. Think of it as the yearly bill. Since Billy broke his arm, he spent $50 for the doctor, $40 for the painkiller, $100 for the specialist, and $3,000. A $1,000 deductible plus $2,000 for the rest of the surgery. Billy has spent $3,190 altogether. Billy's MOOP is $5,000. Billy therefore cannot spend more than $1,810 in copays and coinsurance, not deductible, remember, since Billy already met it with the surgery, but $1,810 is his limit going forward for the rest of the year.